Prehabilitation is a common form of preparation for surgery in order to make sure that the surgery goes well and that the recovery time is as short as possible. Hi, my name is Eric Hammer, registered physiotherapist and owner of Home Comfort Physiotherapy. And today I'd like to talk a little bit about prehabilitation and the importance of this going into different surgeries. So, for example, before a total knee replacement, before a total hip replacement, just the importance of this. But before I continue, please hit that subscribe button below so you'll be notified about any new videos that I have here on my channel. So as I mentioned, prehabilitation, it's a really important aspect in terms of being proactive with preparing for a surgery. So for a lot of patients, for example, if somebody has significant arthritis, whether it's in their hip or their knee, for example, and they're going in for a surgery for a total hip or a total knee replacement, it's going to be very advantageous for the patient to work on things like range of motion or strength or functional aspects in order to try to help with that recovery afterwards. So there's lots of research that shows that depending on how a patient's mobility, strength, their functional mobility is prior to their surgery is really going to have an impact on how well they do afterwards, right? So for example, with a total knee replacement, there's obviously going to be some restrictions in terms of movement after the surgery. This makes a lot of sense, right? So there's going to be a lot of swelling after the surgery. And so as a result of this, there's going to be a lack of range of motion, particularly with flexion. And so what can really be helpful is to try to minimize contractures or improve flexibility and improve joint mobility in through the knee prior to the surgery in order to try to recover from that as quickly as possible. For some patients that I've seen, as a result of, let's say, arthritis in the knee, they might have developed some form of contractures in the muscles of the joint that cross the knee joint. So essentially just tightness and a lack of mobility and flexibility as a result of essentially not having as full a range of motion as possible. And so again, this can be an area in terms of prehabilitation to really work on. So again, this idea of improving mobility, or perhaps there's certain muscles, I'm just thinking again in terms of, let's say, a hip where, again, as a result of pain, perhaps somebody hasn't been putting as much weight through a certain side, and so there can be maybe a lack of strength in the glute muscles, for example. And so that's going to be one of the muscles potentially that if they're having surgery that might be cut through, and again there might be some weaknesses post-surgery then as a result. And so it's going to be really important to try to build up that strength of that particular muscle prior to the surgery to again help with regaining the strength of those muscles and to help with other functional activities such as sit to stand or walking or stairs or getting out of bed. So again, another kind of example of where prehabilitation is going to be really important in order to prepare a patient for surgery and for the subsequent recovery afterwards. If you have any questions or concerns, feel free to leave a comment below. And if you're a patient who could benefit from in-home physiotherapy, if you're looking to regain your function and to improve your conditioning, feel free to reach out. I do have a link below. And also, please check with a physiotherapist or a doctor to make sure that this or any other information is appropriate for you. Thanks again for watching and have a great day. Take care.